Good evening. Good evening. Tahis Love here. Um, just glad to be here to see you once again. Um, and I'm here our first live in the month of April. So happy April, everyone. I'm excited. And this is our um, the day before Resurrection Sunday. Really, really excited. And just want to talk to you for a few minutes with regards to autism, which is um, to, which because today is actually the day after autism um, autism awareness day. Okay, yesterday was Autism Awareness Day, April 2nd. Today being the 3rd, um, I thought it'd be um, fitting to continue with that that particular theme. Now, there are, so many different things that the month of April represents, and especially at this time, this particular weekend is a very, very busy weekend, high holy time for those of the Christian faith in particularly. Um, and you'll hear some of that upon tomorrow. But today I wanted to just take a pause and talk to you about um, uh, awareness, autism, um, the autism spectrum disorder. I want to bring some awareness to autism spectrum disorder. Now, there are, it seems like, as since maybe I would say something like since the early 2000s, it seems like there are more and more um, children being diagnosed with autism spectrum disorder. And the history of autism spectrum disorder um, really goes back, way back, further than that. But the occurrences in the past of someone being diagnosed with that was, far and few between. And so, that's why it was, you know, it wasn't, it was very rarely heard of. But now with current medicine and proper screening and um, new research, we are much more able to readily um, test for, diagnose um, for um, autism spectrum disorder. Okay. Now, looking back at the history of this particular group of disorders, um, that's why it's called a spectrum disorder, because there's a range, and depending on um, the person's um, abilities and um, behaviors, they are placed within a spectrum of behaviors, and the range of the disorder varies. Okay. Now, autism spectrum disorder, it was first believed to be a form of schizophrenia all the way back in 1940. um, the uh, this disorder first made its appearance, and it was believed to be a part of uh, a disorder related to or being a part of schizophrenia. And they had a really difficult time in treating it and even articulating what the symptoms were and what the effects of this particular disorder was. And so they would begin to treat it like as if it's some form of schizophrenia. And so many people were treated as though they were schizophrenia patients. And they found that, you know, even in the way that they were receiving treatment and giving treatment, it was not alleviating the symptoms at all. And so they continued on diagnosing it, researching it as well. And then it was first diagnosed by a doctor by the name of Dr. Bluner. Dr. Bluner. Let me just make sure I got this right, because I went and did my homework. So I wanted to make sure that I give you all the facts with regards to this. Okay. I'm looking for the doctor's first name, and because I'm wondering why I cannot remember the first name, and it could be because Dr. Edgar Bluner. Bluner is his name. And back in 1911, Dr. Bluner had came up with the diagnosis of autism disorder. And at the time, they felt that it was a form of schizophrenia. And so but they noticed that, like, it would show up, and but it was not just one disorder. It was a cluster of disorders. And Dr. Bluner noticed that it was a cluster of disorders that had both behavioral and social symptoms, socially affected symptoms, where the person would simply go into a total withdrawal and would not interact socially with anyone. The difficulty was in their social interactions, and Dr. Bluner, back in 1911, noticed that the difficulty with social interaction was emotionally based. And so he thought it was due to or related to schizophrenia. Okay. All right. And so that was back in 1911. And they continued on with that all the way until we get to 1944, when another doctor, psychiatrist by the name of by the name of Les Kramer. Lee Kramer. Lee Kramer said, okay, it's not schizophrenia, but he said that it's an emotional, it's a set of emotional social disorders that affect interaction, interpersonal interactions. And so Dr. Kramer, was the one in 1944 to say that, okay, it doesn't have anything to do with schizophrenia. It's its own cluster of disorders in and of itself, separate and apart from schizophrenia. And so that was in 1944. Okay. Then we bring it forward. I mean, they still had difficulty treating it, but at least now they knew that it didn't have anything to do with schizophrenia. So the schizophrenia medications did not alleviate any of the symptoms. And it wasn't a byproduct of schizophrenia. They knew now that it's a specifically social emotional disorder. It's a group of them. You know, they found like they called it a cluster. So it was a number of disorder behaviors that one would exhibit at any given time, that where it would affect or inhibit the person from being able to interact socially and emotionally with others. Okay, so that's what Dr. Kramer had found out. Dr. Kramer was very influential in the way his research was very influential in the way that we look at autism today. Okay, all right. So then we come down to 2013, where the American Psychiatric Association further defines autism spectrum disorder. Before it was just autism or autism disorder. Okay. Back from 1944 all the way. In 2013, the autism disorder, it got further fleshed out and defined, and it now is termed Autism Spectrum Disorder. They were able to better understand that cluster of disorders that people would exhibit in their behaviors. So like, for example, maybe in the morning, certain behaviors would be exhibited. By the time the middle of the day happened, slightly different behaviors were exhibited. And then when, the afternoon or evening, then different behaviors were exhibited. But it was all, is all related, all kind of one leads into the other sort of thing. And in 2013, they decided not to call the various disorders clusters or a cluster of disorders. They decided to call it a spectrum, um, shedding light on the fact that the person could vary at different points within the day. Their behaviors, the level of which they were functioning on would vary depending on um, the different environmental stimuli that they were dealing with. Certain environmental conditions also affected and impacted the autism spectrum disorder, as well as emotional state and behaviors as well. And so today we know that emotion that autism spectrum disorder is a group of disorders that are closely related, uh, but vary in that there are different the triggers uh, come from different sources. So, for example, some um, children who are autistic, they may be uh, they may not be comfortable with uh, too much light or too much sound. They get overly stimulated and overwhelmed with too much sound or too much light or too many people. Um, um, and depending on the different things that's in their surroundings, the impact of those things in their surroundings uh, will cause them to exhibit different behaviors. Okay, so that's why it's about the range, and also um, depending on um, the the different impacts, it may limit uh, the person's abilities in different ways. So, for example, and their function. For example, someone who has, well, one of the points on the spectrum, uh, one of the disorders on the um, uh, end of the spectrum, the high functioning end of the spectrum, is called Asperger syndrome. Okay, that is a form of um, that's one of the autism spectrum disorders. It's but with that particular one, the person is very very high functioning, um, and for most of the time, when they become adult, they um, easily can function on a very independent basis and live very productive lives. And then there are um, other disorders on the other side, at the other end of the spectrum, where the person would need or require assistance, throughout their life. Um, Never really becoming functionally independent. Um, and so that's the spectrum. Okay. And so there are different factors that also impact where a person is on the spectrum. Um, and so, uh, depending on where the person is on the spectrum, it also will kind of determine the level of functionality, their abilities, um, what they can and cannot do, and how often they can do it, and things of that nature. So, um, different people have different capabilities, and the different when you're at different points on the spectrum, your abilities vary. Not only does you know where you are on the spectrum determine your level of functionability, but your level of functionability is also impacted by stimuli in your surroundings. So if you are, you know, um, you're light sensitive, for example, or sound sensitive, um, then uh, you would have difficulty in being in places where the light is really, really bright, or um, sunlight, things of that nature. If you're sound sensitive, certain sounds, really impede your functioning. And so um, you would have to be in a place that maybe has to be quiet, or the noise has to be brought down to a minimum, um, and things of that nature. And so those are just some of the things that um, explain the what autism um, autism spectrum disorder is. Okay. Um, they have found, scientists have found that there are a number of uh, genetic markers for autism. There's over 100 genetic markers, um, but those genetic markers, it could be any combination of those genetic markers. It doesn't have to be all 100. It could be, five, or it could be 55, but the genetic markers, um, form various combinations, and those combinations, um, once the autism is diagnosed, um, then you're diagnosed um, according to what your abilities are, um, the 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 stimuli, and where you are on the spectrum. It's a whole lot of different things that come into play when you are diagnosed. Um, most children are diagnosed um, at around 2 years old. That's the earliest that a proper diagnosis of autism spectrum disorder can be determined, simply because around that age you can more readily see some of the signs, and um, a child's capabilities at that age. They're big enough where they, have came across certain milestones that show their abilities or their capabilities. Okay. Um, um, So the earliest a child is diagnosed is 2 years old. Um, and I have a couple of stats here that my research has pointed out to me. Um, Autism is 4.3 times more likely to show up in male children than female children. Um, so, uh, what that means is that male children um, are 4.3 times more likely to get diagnosed sooner than later. The um, the behaviors and um, the behaviors and social implications are boys just you can see it more readily in boys and their behaviors than you can in girls. So boys tend to uh, exhibit the classic symptoms of autistic um, spectrum disorder sooner than and more openly or blatantly, than little girls do. Okay, but um, studies also show that little girls they that that they are better able to mask the symptoms, um, but it also has to do with the way we socialize the children, also, and the way we view social interaction between amongst boys, and then how we view social interaction amongst girls. And so things that we expect boys to do or say or act is different than the way we expect little girls to do and act and say. But the studies show that boys are 4.3 percent, 4.3 times more likely to be diagnosed with autism than girls. Okay. Okay. Um, Now, and boys are more likely to be diagnosed uh, than girls closer to the age 2 also. Okay, closer to age 2. um, little girls, they wind up getting diagnosed much later. And so unfortunately, little girls start getting um, treatment for after they've gotten diagnosed much later, um, whereas boys get their treatment early on. Okay, all right, and so moving right along, in 2018, study the stats said that one in every 59 children were diagnosed with autism spectrum disorder. One out of 59 children in 2018 were diagnosed. And so, I mean, it's occurring and showing up. More and more children are getting diagnosed, and they're getting diagnosed sooner um, due to um, greater screenings and more awareness, better trained medical professionals that can spot it as well. And so the numbers are increasing in terms of, the number of children that are being diagnosed, but they're being diagnosed much earlier. And so they're getting treatment much earlier as well. Okay. All right. So then the children that have been diagnosed with autism spectrum disorder, one out of in 2016, one out of every 34 children that were diagnosed. Now, one out of every 34 children were what is this here? Okay. Oh, the data. One out of every 34 children were would engage in breaking away or running away, and bolting, it's called, away from safety. So that's one of the behaviors exhibited by a child with autism spectrum disorder. They will, if something catches their eye or their attention, they will snatch away and run towards that thing that's caught their eye. And so back in 2016, one out of every 34 children that were diagnosed with autism spectrum disorder exhibited this particular behavior, the bolting or snatching away from a parent or a child care provider or someone who was there assigned to, keep them safe. Okay, one out of every 34 children. Okay, and then let me see. And back in okay, just to show you a little bit of how the autism spectrum disorder, how it's progressing. It was back in 2016, it was one out of every 145 children were diagnosed for that year. Okay. 1 in 145 children were diagnosed as having autism spectrum disorder back in 2016. And I just shared with you that that number had increased to 1 out of every 59 children in 2018 were diagnosed with autism spectrum disorder. So in 2 years' time, the numbers almost doubled in the diagnoses, the number of children being diagnosed with autism spectrum disorder. Okay, and then let me see what else. Just want to make sure I got all of the stats. Oh, okay, here we are. Okay, 31% of children diagnosed with autism spectrum disorder, 31% of them also have intellectual disabilities. Okay, 31%. All right, and that stat is from 2018. Okay, So roughly a third of the children that are diagnosed with autism spectrum disorder, one third of them also have to struggle with intellectual disabilities. Okay. Okay. Stemming from the autism spectrum disorder. Okay. Um, and then I have here, um, okay. All right. Two, no, 18% of the um, of children who have been diagnosed uh, with autism spectrum disorder, 18% of those children who were diagnosed um, have parents that wind up, well, come from families that the parent has a second child also with autism spectrum disorder. So 18% of the families that have had one child already with diagnosed with autism spectrum disorder, 18% of those families um, have uh, a second child or give birth to a second child that also has autism spectrum disorder. So 18% of families of the of those families have more than one child with autism spectrum disorder. That's what that's saying. Okay. And then I have here, let me see, what is this saying here? Okay. Children. Okay. All right. Okay. So, and then, 95% of families that have a child, that have 95% of families that have children with autism spectrum disorder, 95% of those families that have a set of twins, right? 95% of families that has at least one child with autism spectrum disorder, um, oh, they have the child is a twin. Okay, the child is a twin, and so the number of cases with children uh, uh, wait, let me just make sure I'm reading this correctly. I just want to make sure. Yes. 36. I'm sorry. That's what it was. Not 95%. 36 out of every 95 families that have one that have a set of twins. So 36 out of 90, every 95 families out of 95, every 95 families that have at least one child that has been diagnosed with the autism spectrum disorder, 30, the one child has autism spectrum disorder, right? Uh, and out of every 95 families that have at least one child with autism spectrum disorder, 36 of those families have the child that has the autism spectrum disorder is a twin. So 36 out of every 95 families that have at least one child with autism spectrum disorder, 36 of those out of every 95 families, that one child that has the autism spectrum disorder is a twin. Okay, so that's another stat. And let me see what else we have here. One out of every two children that have autism spectrum disorder are bullied. So one out of every two, at least one child is bullied at school, nonetheless. So, these numbers, these stats, they just point out different aspects that a child that's been diagnosed has to deal with. Okay. And then, 28% of autistic spectrum disorder diagnosed children, 28% of them engage in self-harmful behavior. Okay. 28% of all the children that are diagnosed engage in self-harmful behavior. So they will do stuff like, bang their head up against the wall, or if they, have sharp object, they will cut themselves, or, do something that's self-harmful. That's what that means. Where they inflict harm on themselves. 28% of artistically diagnosed children they engage in self-harmful behavior. Okay, and then let me see. I think that's also let's see here. One out of four parents of children diagnosed with autism spectrum disorder, one out of every four parents will accept, and receive training to help them better care for their child that's been diagnosed. One out of every four parents. You would think that, that number should be much higher. Like 4 out of every 4 parents of autistic spectrum diagnosed children. You would think it would be much higher, but it's not. But thank God for awareness and sharing these stats. More and more parents are becoming aware of the need to also um, get trained and do the research so they can be better care providers of their children once they've been diagnosed. Okay. Now there are what are some of the symptoms of autism spectrum disorder? Okay, what do we look for? There are a couple of things to look for, but the best way to find out is to go and have your child evaluated. Okay, you have to go to a psychiatrist or a psychologist or a neurologist. They are the ones that can administer the proper screenings so that you can determine not only whether or not your child has autism spectrum disorder, but they can be the best ones to tell you exactly where on the spectrum your child is, okay, or your loved one, because um, there are adults that are on the spectrum as well, okay? All right, so symptoms to look for, okay? Like I said, the earliest children are able to be diagnosed is the age of 2, all right? And so, by the age of 2, you want to look for different signs. If there is a lack of sharing or sharing sounds, trying to talk or making audible noises by the time the child is 16 months, that might be a symptom. Okay, so if the child doesn't make any sounds or any attempts to, at baby talking, by the time they are 16 months, definitely have your child evaluated. Okay. Another thing is if the child does not attempt to make facial expressions or smile when you're talking to the child, or different, the child is watching something and the child does not attempt to smile or make a facial expression when interacting with others, you need to, between the ages of 9 months and 16 months, you should go and make sure the child is evaluated. Okay. So those are some things that that you can look for. Early signs that your child may need to go for the autism spectrum disorder screenings. Okay. And so I just wanted to share these stats and make you aware of certain things in honor of National Autism Spectrum Disorder Awareness Day, which is April 2nd. I do know today is the 3rd, but we didn't see each other yesterday. So I wanted to bring it to you today so that the day would not, you know, the opportunity for spreading awareness would not just dissipate. Okay. And so if you or someone that you know may be experiencing, you know, emotional, emotionally social difficulties, they may need to get um, evaluated. Okay. And so I just wanted to come before you and share that. Um, that's all that I have. If you have questions or um, you you want to arrange for um, an evaluation, again, um, you can contact the American um, Psychiatric Association, also the National Autism uh, Spectrum Disorder Association as well. Um, and they have a lot of information. Um, if you are a parent, um, I would encourage you to get the training um, so that you can better care for your child that's on the spectrum. Also, I would encourage family members um, to also get the training so that um, there's more people that are aware and can provide proper care for your loved ones that may be on the spectrum. Another thing, continue to spread the awareness. Um, I called out some stats, pointing out that 50% of children with autism spectrum disorder, 50%, one out of every two, are bullied at school. And that stat jumps out at me because that just says to me that our educational staff needs some more training and to help create a more conducive environment for uh, the children with that have been diagnosed. Um, Children should not have to go to school in fear of being bullied. Okay, so we have to do more in terms of awareness and education. Um, and so we'll also need more sensitivity training with regards to um, medical staff, like when we bring children in for their regular checkups and things of that nature. Um, some more sensitivity training needs to be done there. Also, um, sensitivity training should be given to people who work in malls and um, different places like that where there are large crowds. Um, if they had more sensitivity training with regards to autistic children and people with autism, they could make places like a mall or a large stadium much more comfortable for people living on the spectrum. Um, and so, you know, more awareness just has to be um, made and spread so that people can really understand the need to be tolerant, kind, and sensitive to those that are on the spectrum. All right, so if there, I didn't anticipate a lot of questions, but your comments would be very much welcomed. Um, and don't forget to like and share this video. Um, share it with someone that may have a loved one that is on the spectrum. Let them know that they are not alone, that there is plenty, plenty, plenty of research and information that is out there to help them. Also, share the information with uh, families so that more of us can be aware and more of us can be um, sensitive and, not conduct ourselves in a way where our behavior further impedes someone living on the spectrum. Okay. All right. So, and I see one more thing here. Oh no. Okay. I read that already. Okay. So that's all that I have for you this evening. Thank you so much for taking time out to um, view this live. And I hope that and pray that something that I shared was informative, empowering, and inspiring with regards to autism spectrum disorder. Okay. Um, and so uh, I'm going to prepare to sign off. Wait, let me just see who's here though. I like to do that. Um, I know that some of you all are busy anticipating uh, Resurrection Sunday, which is tomorrow. Um, some people are somewhere getting their spring and uh, Easter outfit together and stuff like that. I get it. So I didn't want to be before you a very long time. Uh, somebody's cooking uh, Resurrection Sunday dinner, and so I'm all too familiar with all of that. But I do want to. I just wanted to take this opportunity to bring and spread awareness with regards to uh, autism spectrum disorder. I have some really good friends that are parents of children living on the spectrum, and uh, they are some awesome parents. And shout out to you parents. I know it's not easy, but you're getting it done. And your children benefit from your efforts. Okay. Okay. I see here that Reverend Flo Changajita is on and watching. Thank you. Thank you. And then I see, she says, what about being fixated with um, holes or terrain or being fixated with wheels or trains or certain shapes? Yes. Many children on the spectrum, you know, they get, their attention, their eye gets drawn to certain things, uh, and it fascinates them, and they will oftentimes break away from whomever is walking with them and run to that thing. And if you're not aware that that's what's going on with the child, you may not move fast enough to prevent the child from placing themselves in harm's way. And so having that training, that additional sensitivity, you know, everyone can help in making sure that the environment is safe for everyone, including the child. That is true. Thank you, Bev, for that point. Um, and then, places like, the train station, you know, staff, you know, can use some training in terms of sensitivity, with regards to that. Okay, I see that Sister Shireen Stover is on and watching. Hello, hello. Thank you for watching. Okay, and she was having a conversation. Um, um, oh, and she was saying how the government um, uh, deals with parents and the pharmaceuticals also in administering medications, the pricing of the medication for people living on the spectrum. Um, they were having their own conversation with regards to that. I see Angie Camacho Lopez, Chaplain Angie is on and watching. Hello, hello. Good to see you. Thanks for tuning in. And she says, what are the different therapies that are implemented for autism spectrum? Okay. There are a number of different therapies that are offered. Like I said a little bit earlier, um, because there's a range, there's a spectrum. There are different therapies um, geared towards those that are on different places on the spectrum. And then it's not a one size fit all, not at all. There, um, you know, your child or someone that living on the spectrum, they may have to have um, occupational therapy along with some speech therapy or along with some different kinds of behavior therapy. Um, it's a combination, and so parents very often, um, if they don't have the training, um, they find themselves literally, just jumping around trying to, figure out, okay, what to do next. That training and doing your research does help tremendously in terms of what services are out there that uh, you can make accessible to your child, if it's your child, or to that loved one that is living on the spectrum. But there are a whole host of different therapies and combinations of therapies. You would then, after your loved one has been diagnosed, uh, you would then work out a plan um, to make sure that you get or you provide all the therapies that your loved one can readily utilize. And uh, that's how you would do it. And again, I can't say it enough, do your research. Do your research, do your research, do your research, because what might work for this family over here may not work for this family over here. Um, so, see what's out there and go after it. See what's accessible, to you and go after it. Very often family members have to become advocates also for their loved ones that's on the spectrum. Um, and so the more informed you are about your loved one's particular conditions, the better you can advocate, the more services and access to services and therapy and all of that that you will uh, gain for your loved one. So that was a really nice question, Chaplain Camacho. Thank you. I'm looking down here now, and so yeah, it's so sad how whole families are impacted by having a loved one um, living on the spectrum. Okay. I also see Mr. Kenneth Love is on and watching. Hi, honey. How you doing? Thanks for watching. Um, Reverend Flo Changajita, she wants to shout out um, Sarah, who's doing a great job with her son. Oh, shout out to Sarah out there. I know I have a couple of friends. Uh, Shout out to um, my friend and sister, Matthias Francois, who is the mother of four, and she has a son that's on the spectrum as well and doing an awesome, tremendous job. I know of another young lady, Chaplain Michelle Brunson, who is a parent of, she's a parent of two children, and she's an awesome um, parent with her son that is on the spectrum as well. And so, you know, I know it's not easy, but shout out to those parents that are going above and beyond and just doing the thing. Um, Keep up the good work. I learned so much from my friends and people that are, in my circle. They've taught me so much about autism and living with someone that is on the spectrum, and really opened my eyes and helped me to be more aware and, you know, to try to facilitate as best I can in providing a safe surrounding for those of us who live with people who are living on the spectrum, you know. But thank you for that comment. Okay, what else I have here? Yes, um, Chaplain Reverend Flo Changajita knows. She knows Chaplain Michelle um, Brunson. She says, yes, Chaplain Michelle, indeed a great parent for both of her children. Yes, she is. Both of her children are on the spectrum. Yes. Okay, and so thank you all for your comments and questions. Continue to put your comments in the chat and your questions. I do love to go back even after the live and um, read your comments and respond. And so thank you so much for that. Thank you to all of you who are watching and you're in the background, or you might be listening. but thank you to you as well, because your presence also is vital. Um, so I just want to thank you all for spending this time with me and allowing me to share and celebrate um, National Autism Spectrum Disorder Awareness Day, which is April 2nd. But we're celebrating it today, April 3rd. At least I am. Okay. But yeah, thank you all so much for tuning in. Um, I'll be here again upon tomorrow. Um, my next live will be tomorrow at 1 p.m. Yes, on Resurrection Sunday. So I'll be looking forward to seeing you all then to hear what thus saith the Lord. And then I'll be back again on Monday at 11 a.m. Where we are going to continue to talk about self-care on the Me Time Monday show. And I thank all of you who tune in and uh, share the videos as well. Thank you all so much. Shout out to Minister Lee. Um, she made it known to me that my YouTube family is they're watching, and they want to see me on the YouTube. So I'm going to be uploading some more content onto the YouTube channel and everything. And so you all feel free to catch me on YouTube at Dunamis Sound Mind Services on YouTube. And what else? Let me see. Don't forget to like, share the videos, and subscribe to the channel. Okay. Because I'm going to be doing some new things. I'm going to add an additional program really, really soon. And that's going to be featured on my YouTube channel only. So it means that, you all who watch me on Facebook, you have to go to the YouTube channel to see that. It's a program that I call the Overcomers or the Conquerors program. So I'm going to be bringing that to you really, really soon. And that's pretty much it. So I'm going to let you all go on ahead and enjoy the rest of your evening. Thank you so much for spending this time with me. I'll see some of you tomorrow. I'll see even more of you on Monday, and I'll see even more of you next week, Saturday at 6 p.m. Thank you so much. Bye-bye now.